Aspirin is a very important drug. Aspirin is a drug which we give in pregnancy routinely. We also give aspirin in treatment of infertility, especially during IVF or during IUI or during unexplained infertility. Why aspirin is given, in what dose aspirin is given, for how long aspirin is continued, does aspirin lead to increased chances of bleeding, are there any side effects of giving aspirin? We'll discuss all these questions. Good morning, I am Dr. Rajat and you have started watching our YouTube channel, The Fertility Gynecologist. Many times when I give aspirin to my patients, some patients who are well read, who have done enough research on Google, or who have some kind of a medical background, or whose some family members are either a medical store owner, whose some relatives are a doctor, nurse, they come and tell me and or ask me again, sir, why you have given this tablet? This tablet is used for thinning the blood. In local language we call it as खून पतला करने की दवाई. Why this tablet is required in pregnancy? This is usually given for people who have got heart attacks, who have got paralysis, who have got stroke. In those kind of patients it is given, and in pregnancy it should not be given. Now they have a partly correct information and partly wrong information. That is why I say you should have full information of all the topics. That is why I am making this video today. Now first of all, you have to understand what is the pathophysiology or the logic of giving aspirin in patients of myocardial infarction, stroke, paralysis, all these kind of things. There are two types of aspirin. One is a main aspirin that is called as Disprin, that is 500 or 650 milligram dose, that is mainly used for treating the headache or any kind of a body ache. But few years after this Disprin was invented or discovered, the scientists found that this aspirin in small doses, in 50 milligram, 75 milligram or 150 milligram, which is also called as baby aspirin or low dose aspirin, it acts as a anti-platelet agent. It prevents the accumulation or formation of a platelet plug. Now what does this platelet plug do? To know what is platelet plug, we have to go in the basics of physiology. Whenever there is any injury, there is a bleeding from that site. There are two things in our body which God has given us to prevent the bleeding or to control the bleeding. One is the presence of clotting factors in blood, and which are the first activators the moment there is any injury to the blood vessels, there is a bleeding. Because of that clotting factors in blood, the blood would start coagulating. After few time, that is called as clotting time. After few minutes, the platelets in the bloodstream, they would get attracted to that side and they would form a mesh kind of a structure, and that is called as a platelet plug, which in our local language we call as a thrombi. These are the two mechanisms by which the blood coagulation occurs. In cases in which there is an excessive coagulation of blood, which happens in stroke, which happens in myocardial infarction, which happens in paralysis patient, these thrombi are basically more common, and the microthrombi are common in the small vessels of the critical organs like brain, like heart, maybe kidney, and they decrease or disrupt the blood supply of that particular organ or the portion of that organ. If a particular artery in the brain, for example middle cerebral artery, the anterior branch or the posterior branch or whatever branch, then there would be the infarct of that area of that brain, and that would lead to the paralysis of that part of the brain, paralysis of that part of the body to which that brain is controlling. Same happens with heart. There can be a myocardial infarction, there can be an anterior coronary artery or the right coronary artery or whatever, wherever there is a thrombi, that portion of heart becomes weak, infarcted, or maybe and ultimately may lead to the myocardial infarction or heart failure later on. Aspirin, baby aspirin, if it is used, it will prevent the formation of platelet plugs, it will prevent the formation of microthrombi, and thereby would prevent the acute attack or the reoccurrence of the attack in this kind of patients. So what has this got to do with pregnancy? Pregnancy is a procoagulant condition. By means of procoagulant, I mean there is a relatively increase in the number, in the amount of coagulating factors. There is a relative increase in the amount of platelets. This mechanism has been made by God because during delivery there is a bleeding of approximately 500 to 700 ml of blood during the separation of placenta, and to counter that, so that the bleeding does not occur excessively, God has made this pregnancy hypercoagulant condition. In few females, there are anti-autoimmune disorders. Like some females have thyroid, some have premature ovarian failure, some have uh, antiphospholipid syndrome, anticardiolipid syndrome, anti-nuclear antibody, lupus anticoagulant, anti-thyroid antibodies are positive. In those females, there is a generalized increase in the coagulability of the blood. If these females get pregnant, then the chances are that because of this increased coagulability of blood, because of these autoimmune disorders, the pregnancy may miscarry, the abortion may occur, the missed abortion may occur if it is relatively high earlier in the pregnancy, or in the later half of the pregnancy, the blood pressure may increase, the blood to the fetus may decrease, the growth of the fetus may be retarded, fetal growth restriction may occur, or the water around the baby may decrease, the oligohydramnios may occur. That is the logic of giving aspirin in the pregnancy. So that comes to my next question. Most of the people ask me, why me? I do not have this anticoagulant disorder, anti-autoimmune disorder. So why should it be given to me? Now, most of these autoimmune disorders are in the latent form. They are not active. They do not have any symptoms. And what we have found out is it in pregnancy uncovers most of these autoimmune disorders. Most of the females get to know first time in pregnancy that they have some kind of a thyroid disorder. If we check extensively, they might be having autoimmune antibodies. Some people have decreased AMH. Most of the causes of decreased AMH are because of premature ovarian failure, and most of it is related to the autoimmune cause. Some people have different variations, different titers of autoimmune antibodies, like anticardiolipin antibody, lupus anticoagulant, antinuclear antibody, etc., in their blood. So that is the logic of giving aspirin in pregnancy. In what cases do we prefer aspirin in pregnancy? Baby aspirin or a low dose aspirin in pregnancy? In all those females who are obese, who are more age, more than 30, who have got past history of multiple abortions, past history of multiple miscarriages, past history of intrauterine fetal death, that means demise of baby in the uterus, past history of hypertension or increased blood pressure in pregnancy, past history of preeclampsia, convulsion in pregnancy, past history of gestational diabetes mellitus, or they have hypertension in this pregnancy, they have diabetes mellitus in this pregnancy. Those females who have IVF conceived, especially frozen embryo transfer, who are infertility conceived, who have got multiple IVF failures, the list goes on and on. In these kind of cases, the role of aspirin is must. When should we start aspirin? Ideally, the aspirin should be in an ideal world, the aspirin should be started at 12 weeks of pregnancy. Why that 12 weeks of time is important? Now, the moment the placenta formation starts occurring between 7 to 12 weeks of pregnancy. Placenta is nothing but the decidua of the fetus. It goes inside the myometrial wall, and from a high pressure circulation, it becomes a low pressure circulation. That low pressure circulation has to be maintained in the pregnancy to prevent the rise of blood pressure. But in few cases in which a defective placentation is there, that means this high pressure circulation of normal uterus is not converted into a low pressure circulation. In those cases, the more chances are that at about 7th, 8th, 9th month, there would be increase in incidence of preeclampsia, rise in blood pressure, or fetal growth restriction in pregnancy. That is why in those cases we have to start at 12 weeks of pregnancy. How do I know that there is a defective placenta or this high pressure circulation is not converted into a low pressure circulation? There is something called as a uterine artery resistance, which we get to know by doing the Doppler of uterine artery and uterine artery PI. If it is more, especially in both the sides, then it tells me that there are increased chances of preeclampsia later on in the pregnancy, and in those cases we will start aspirin, preferably 150 milligram. But for me, in my practice, what I do is I start aspirin from the day one the pregnancy is confirmed on ultrasound. And in those cases who have past history, like I mentioned, multiple abortions before, past history of autoimmune antibodies, past history of multiple miscarriages, intrauterine fetal death, hypertension, I start low dose aspirin the moment they have a urine pregnancy test positive. In those cases we start. And in infertility patients, usually the aspirin is keep on continuing. Now the Cochrane studies, they say that the aspirin does not have any tangible benefit in infertility. Now I personally believe that because aspirin, it does not decrease the platelets in blood, it only prevents the platelet plug formation. So it prevents the accumulation of platelet and thereby prevents the formation of microthrombi in blood. And that is why aspirin logically helps in improving the blood supply to the uterus and to the ovaries, and thereby improving the chances of pregnancy either normal or with IUI or with IVF. People say, what dose aspirin should we start it? Earlier people used to start 50 milligram, 75 milligram, but nowadays the standard dictum is that 150 milligrams should be given. If the patient's weight is very low, say 35-40 kg, then in those cases maybe we can start 75 milligram, but ideally it should be 150 milligram. In pregnancy, aspirin should be continued till 36 weeks. In an ideal world, ideally it should be continued till about 7 to 10 days before delivery, but we do not know when the labor pain would occur, so we tentatively stop aspirin at 34 to 36 weeks. The life cycle of the aspirin action on the platelets happens for about 7 to 10 days. So if we stop for 10 days before delivery or before our anticipated cesarean section, then the aspirin action would wear off. But in many times I have found out that people fear that by if the aspirin is continued till delivery or during the time of cesarean section, it may lead to increased chances of bleeding. It may lead to increased chances of bleeding during cesarean section. Sometimes in past, the patient was continuing aspirin and that patient came with preterm labor pain. I had to do cesarean section or I had to do normal delivery in those kind of patients. Still, I did not find any increased incidence of bleeding. So that tells me that even if the aspirin is continued till about delivery, it won't have any effects. Especially in those kind of cases where there is a severe fetal growth restriction, severe preeclampsia, and we have to terminate the pregnancy at 30, 31, 32 weeks, it is better to continue aspirin till the delivery or till cesarean section. However, that may sound controversial, but I have found more results. See, I do a risk benefit analysis. What is the risk of continuing aspirin versus what is the benefit of continuing aspirin? In those patients who have got multiple history of abortions, multiple history of intrauterine fetal deaths, or the past history of preeclampsia, aspirin decreases these chances of unexplained fetal demise, unexplained fetal IUFD, blood pressure in pregnancy, lot. And compared to that, the risk of increased bleeding is minimal. So many people ask me, does aspirin decrease the blood pressure in pregnancy? Answer is no. However, in a normal person, when that person is lying down, when the person is lying down supine position, there is a normal fall in blood pressure, and that normal fall in blood pressure is prevented by the activation of renin, angiotensin, aldosterone system. This RAA system decreases the fall of blood pressure and thereby maintains the normal blood pressure. As in patients who are hypertensive, if this RAA system is active, then the blood pressure would shoot up, and aspirin prevents the activation of this renin, angiotensin, aldosterone system, and thereby it prevents the rise of nocturnal fall of blood pressure. So thereby it helps in the hypertensive patients. Now, because an aspirin belongs to a group of drugs called as NSAID, non-steroidal anti-inflammatory drugs, and NSAIDs are famous for inducing gastrointestinal side effects like gas, acidity, ghabrahat, maybe vomiting. Some people even say peptic ulcers. Does baby aspirin cause all of them? Having been in practice for about 15-20 years, and I normally prescribe aspirin to each and every of my patient, be it infertility or of pregnancy, I have found almost minimalistic people complain of gastrointestinal disturbance on aspirin. Yes, some people may have gas, acidity, but that may subside after a week of 10 days. And how should you take an aspirin? It should not be taken on an empty stomach. Ideally, it should be taken after meals. I prefer aspirin to be given after dinner, because in my practice I give iron after lunch, which I mentioned in my previous videos. The moment you take more medicines like iron, calcium, low dose aspirin, maybe folic acid, maybe thyroid, or some people are on anti-diabetic medicines like metformin, all these combined would cause increase in gastrointestinal disturbance. But per se, aspirin does not cause high risk of gastrointestinal disturbance in pregnancy. Does this aspirin have to be taken daily? Answer is yes. What if some patient forgets to take one tablet daily? See, occasional forgetting of the tablet for one day may not hinder or may not harm, but you should not make it a habit to forget daily. Occasionally forgetting or skipping the tablet is not an issue. So this was my small bit on aspirin. Take home messages is you have to take baby aspirin, that is 75 milligram or 150 milligram. For extreme low weight patients, say less than 40, you can give 75 milligram per, but any patient more than 40 kg, 45 kg, you should give 150 milligram. I normally start aspirin from the moment the pregnancy is conceived till delivery, but books say from 12 weeks to 36 weeks they should be given. You can stop aspirin 7 to 10 days before your expected date of periods or expected date of delivery, or 7 to 10 days before you plan to do a cesarean section. It is almost harmless, and taking aspirin in pregnancy does not lead to increased chances of bleeding in pregnancy. If sometimes the bleeding happens on, if you are on aspirin and there is a cut or there is a bruise or there is a wound, just press it for 4 to 5 minutes extra with maybe ice application. The bleeding would stop and there would be no side effects. Please like the video, share the video, and subscribe to our channel. Thank you. Bye bye.